Hello, and welcome to the Ovarian Club, a glimpse into conversations between two besties across countries, South Africa and France, tackling the trendiest women's wellness topics through a scientific lens.
Join me, Dr. Tarryn, and health expert Emma as we explore delicate subjects related to the women's health space.
We started this podcast to share our conversations to help navigate the complex women's wellness world. We hope you enjoy the podcast and take away as much from it as we've enjoyed making it.
The Ovarian Club, powering life, nurturing health, shaping sustainable wellness. So, my follicle friends, let's begin.
How's it, Ta?
Hello, follicle friend. Are you excited to talk skin follicles? Because I am.
Skin follicles? What the hell, skin follicles?
Well, we're talking acne, no? It's all about the follicles and the skin, the glands that become hyperinflamed. I'm so excited. It's literally my favorite thing to talk about.
I'm also so excited to speak about skincare. For those of you who don't know me, I'm obsessed with skincare. I spend hours upon hours upon hours researching skincare, and I just love it. All the latest trends, all the latest gizmos, all the latest stuff. But I have to be honest with you, there's also so much out there that makes it very overwhelming. There's just so much like new stuff, like now it's castor oil, then it's red light therapy, then it's this facial, then that facial, and then the expense of this stuff. It's very baffling, but I'm very excited to break it down and excited to speak more specifically about hormonal acne. I want to hear about what hormonal acne is, where it comes from, what the treatment options are, what actually has scientific backing. Me and my little current buddy face mask that I love to freak my husband out with, and he gets a heart attack every time he comes home and finds me meditating with my legs up against the wall and this red light all over my face. Poor man, his heart. But anyway, so really, really excited to dig in. But before we do, just a small disclaimer. This podcast does not reflect the views of the company I am employed by. And with that disclaimer out the way,
it's my turn. Hi, everyone. I'm Dr. Tarryn. And yes, my disclaimer is that although I am a qualified medical doctor, this podcast does not serve to offer any personal medical advice. So always seek the advice of a healthcare professional with regard to any condition or treatment you may be seeking. And the second disclaimer is that I am not a qualified board-certified dermatologist. I am a general practitioner with a special interest in both women's health as well as skin health. So I may not have all the answers, but I definitely have access to the latest up-to-date research, and I really strive to deliver information that is accurate, up-to-date as of March 2025. So, yeah, really excited to chat acne, rosacea, melasma, anything you want, Em, shoot away. Let's go.
Well, I think the topic of skincare is so broad. I mean, I can speak for hours and hours about it, but today I want to just focus in on hormonal acne, which is a topic close to my heart, especially having just been diagnosed with PCOS and having that just wreak havoc with my skin. But I'd really love to understand what is hormonal acne? What causes it? Can we break it down and understand it a little bit better?
Yes. So the classification hormonal acne is not one of my favorites. I'll tell you why. That is because I believe that almost all forms of acne are hormonally mediated. Of course, you do get different types of acne per se that may not be as hormonally mediated. For example, cosmetic acne or drug-induced acne from, like, say, steroids or progestins. We'll go into all of that later. But generally speaking, hormonal acne and acne, I mean, it's basically one of the same because it is such a driving process in what we see with the acne presentation.
And what causes hormonal acne?
So basically, there are four key driving processes that drive the clinical presentation. The first one is abnormal keratinization of the sebaceous follicles that sit on the face. And keratinization, it's just a protein, and basically it's a hyperproliferation, so just lots of the protein being produced in excess. Okay, that's the first hallmark feature. The second one is excess sebum production. The third one is the presence of a bacterium, gross, right? Called Cutibacterium acne, and that colonize the face. And then the fourth one is a result of all of this, which is inflammation. So basically, in simple terms, the excess sebum, along with the increased turnover of the cells, so the keratinization, leads to the formation of the comedones. Basically, the blackheads. Remember, Eb, when you were busy picking at my blackheads in the garden route? Yeah, I mean that, right? You know what that is. So just for all the listeners, Em had like a heart attack when she saw me in my Comsevere, like all stressed out and dying. And she's like, we need to do something about this. And this is obviously not medical advice because we do not advise picking at the comedones, but it was just such a desperate time in our lives. So we did resort to that.
Oh, okay. So sorry. Can I just take a step back? And because I mean, like, you mentioned a bunch of really like fancy terms.
Yes.
Protein, sebum secretion,
Yes.
so excess sebum,
Yes.
so that's like your oils and stuff, right? Because
yes, exactly.
that's more the one that's more commonly known, right? So the excess
Right.
oils that are produced, you mentioned also the excess protein and or not the buildup of
Or
protein,
keratin,
right?
keratin.
And the excess kind of oils in the form of sebums, then that triggers the
Comedones.
whiteheads, blackheads, etc.
Clogged pores, basically.
Clog pores. And you also mentioned obviously the bacteria, right?
Well, yes. So the bacterium love chilling in these little clogged pores. They chill there and they feed off the sebum. Okay. It actually provides them nutrients and that's how they proliferate and thrive. And then this triggers inflammation in the body because the body recognizes the bacteria and then the body begins a whole inflammatory cascade to counteract the bacterium. And this causes inflammation, pustules. I mean, this is in the case of the more inflammatory type picture, right? Because acne can present in many forms. Some people have mild acne where they've just got small little comedones. Others have more inflammatory acne with pustules and papules. And then you also get the nodular acne where it's more, big, thick, deep cystic nodules on the face, right? But it doesn't matter which type of acne we're referring to, it's driven by the same process. So yeah, basically those are the 4 hallmarks. And I think it's very important to understand because now we can discuss the role of hormones and how it interferes with this cascade.
So how does it? How does it involve?
Okay.
I mean, you painted quite a vivid picture there of this bacteria that's feeding off of the excess oil.
Yes.
What does, I mean, estrogen, progesterone, all of these things, what does that do? Testosterone.
Yes. So you actually named the main driving one, testosterone, otherwise known as androgens, right? So androgens is like the generic name for the male hormones, like testosterone. And basically, it's the testosterone that drives this process because it plays a role in stimulating the growth of the sebaceous glands, which in turn produce more sebum. So yes. So estrogens actually protective. It counteracts the testosterone, which is why taking an oral contraceptive pill, which has estrogen, is actually very beneficial for patients who have acne. But the converse is true for progesterone. Progesterone somehow fuels and feeds this whole androgen driving process and actually makes the skin worse. So you got to be very careful with regard to what type of pill you're taking and the ratio of the estrogen to progesterone. Because if it's more estrogen dominant, it should be protective against acne. Okay?
But if testosterone has such a big role to play in all of this, then why? I have a feeling like, especially when it comes to women, we suffer a lot more from this hormonal acne than men do, right? Like, I mean, you always hear these stories like men that are just using like the bar of soap that they also use for their hand, that they use for their body and everything as a face wash. And here us women are with like a 10-step Korean skincare programs and routines, and we're here breaking out every single time it's that time of the month. So why is it that if testosterone is such a big player, then why is it that it affects women so disproportionately?
So remember, women have more testosterone than we have estrogen. So it's actually a fun fact that people don't think about. So women have a lot of testosterone, but in addition to testosterone, we also have estrogen and progesterone. So it's just like way more hormones in general.
Okay. And that's why we're more sensitive to these hormonal fluctuations that could then cause these outbreaks.
Absolutely. And, in adolescence, we might actually see like an equal distribution between males and females, but post-adolescence and in the 25 plus age group, it's way more common in females. And then this decreases with age. So as you go into perimenopause and menopause, you would tend to lose the acne, which is good to know. That's one positive, right? We mentioned all the negatives in the last episode. This is one positive.
And when you have your period, for example, before your period with
Yes.
PMS or something, you then like would your hormones fluctuate and everything like that. Would you then be saying that you produce more testosterone and then that triggers acne, or is it the drop in estrogen? What is
Yes. It's the drop in estrogen, right? Just premenstrual, just before you get your period. And then as you get your period, the estrogen's at its lowest, so it's not as protective to counteract the androgens. And then as you go into the menstrual cycle, the skin should actually improve. So it's very much a pre-menstrual and then menstrual phenomenon. I mean, I know it happens with me terribly. Like I can almost tell when I'm going to get my periods just because of the breakouts on my chin. It's so predictable.
and why does it happen? I mean, like, sorry, I know I'm like jumping from topic to
No.
topic, but why does it happen on your chin? Like, especially this area?
Yes. So this is because the chin and the lower face contains many, many hormone-sensitive oily glands. So it's just a higher concentration of glands that chill there. And because of that, we see the increased sebum production in the chin and acne that can pop out.
And then one other thing I've noticed, for example, when I eat dairy, I break out exactly in the same spot. So if I were to eat like a lot of dairy, and it depends also, strangely enough, which kind of dairy I'm eating. So when I do eat dairy, my skin does like break out. And I have friends that tell me like if they eat like, for example, Magnum or something, their skin just bam, the next day, pimples all over their chin. What's the story there?
The role of diet in acne, it's an evolving concept. So several studies have suggested links between increased milk consumption in the form of dairy, as well as high glycemic foods, that there is this association. However, prospective studies are yet to prove these observations. So as of March 2025, I cannot say conclusively that dairy and high glycemic index foods cause acne, but it is most certainly observed. And I also know from personal experience that this does happen. And you touched on the types of dairy, and it's interesting that it's actually low fat milk is more of the culprit because it's more highly processed. Basically, there's thought to be links between the consumption of low fat milk and a hormone known as insulin like growth factor, IGF-1. IGF-1 stimulates sebum production. So there's thought to be these links between the two, yet to be proven. So yeah, I mean, I can't say for a fact that dairy drives this process, but low fat dairy seems like it might be a culprit somewhere along the line. Studies
That
yet
would
to
make
prove this.
that would make sense, right? Because I mean, if you're thinking about, our grandparents' generations or whatever, they didn't seem to have that. But then like lately, there's all this stuff like eliminate dairy from your diet. But then I do actually notice when I'm eating my like tubs of full fat Greek yogurts, which I adore, I
Yeah.
don't necessarily have as much breakup. It just really depends. Like, so it is about the more processed.
Yes, I would say so. And I think just knowing your body's cues, I always tell my patients to keep a food diary because, I mean, you know your body and you know what triggers you. So identify the triggers and yeah. But I mean, there's definitely other triggers which are well identified. So, for example, smoking. I can't speak to vaping because the consensus isn't out yet, but smoking and acne are linked. So there is definitely a causative relationship that has been shown. And then, yeah, we already mentioned IGF-1, but that's all tied in with insulin resistance. It's also thought that patients with insulin resistance, which we also see with PCOS, that there's also a correlation there. So those are some of the well-established correlations.
And what about when you're pregnant? So some pregnant women have like pregnancy glow, right? And they have like amazing skin and they're talking about, oh, the skin's amazing. And then you have other women that's, report that they have terrible skin and that their skin is broken out throughout pregnancy. Why is that?
Yeah.
Why do you have this discrepancy then in pregnancy if it is just linked to hormones?
So I can't say for a fact that we see an intrinsic link between acne and pregnancy. I'm not familiar with any studies, and certainly from my own encounters in the wards, I didn't notice that working in an obstetric ward. But there is definitely a link between skin health and pregnancy in that melasma which is a chronic relapsing skin condition. This tends to pop out in pregnancy, and it's basically a hyperpigmented clinical presentation. Hyperpigmented just means dark spots that appear centrally around the face. And I think with regard to your question, like why do some get it and why others not, this is genetics. I mean, a lot of it is genetics based. And some women, get exposed to the risk factors and then just causes their skin to erupt into melasma, whereas others may be exposed to the same risk factors and they don't. So I think at the end of the day, genetics has a huge role to play when it comes to the skin.
And is there anything then also other disorders or other skin things? So melasma you mentioned, but like one of the things that was interesting is that, I mean, God, I sound like a hypochondriac. I swear I'm not. So I do have like redness and inflammation and stuff like that. And then I was doing like this face scan thing. And then I remember also someone mentioning that I maybe have rosacea.
Rosacea.
God, I should probably know how to pronounce it if I have it. But anyways, and then I was reading online and somewhere I was reading that actually the acne could be rosacea and not necessarily just like acne. And I know the two things are different. So I'd love to understand like what rosacea actually is. And then how to know like you have that, or maybe it's acne, or maybe it's something else, like just like irritated skin. How do you know if it's hormones or whatever?
No, very, very good question. And the diagnosis can sometimes be a bit confusing because there is a bit of overlap between the two. Let me quickly just define what rosacea is. So it's a chronic inflammatory skin condition that is actually mediated by the immune system. So it's more immune driven as opposed to hormonally driven. That's the one key distinguishing feature. And it's also not characterized by the presence of the comedones. It's more flushing, redness of the skin, oh gosh, I can't pronounce this word. The dilated blood vessels, it's called telangiectasia. Okay, telangiectasia. Gosh, but basically dilated blood vessels, that you see superficially. I should really know how to pronounce that word. And basically, yeah, so sometimes it can become inflammatory in nature, in which case one would see pustules and all of that. And that is where there is quite a bit of overlap between the two. But the pathophysiology is a bit different. It's a different type of bacterium that would colonize if it does colonize at all. And the management is different. There is some overlap, but the primary first line management for rosacea is different to that of acne. And also acne, it's more of because it's more hormonally mediated, especially in the case of PCOS, you tend to see it in the younger age groups, like 20s, 30s. But rosacea is more midlife, typically, maybe 30s, 40s plus. So that's also like a nice way to tease it out. If in doubt, of course, consult a doctor who can make that assessment.
We've spoken about the causes of hormonal acne, the buildup of proteins, the sebums, the testosterone feeding off the sebums. We've spoken about the rosacea. We've spoken about, I have gone completely blank on the name of the melasma. Also that women actually have more testosterone than they do estrogen, hence why women also get more acne later on in the adulthood as opposed to men, whereas it is equal in teenagers. Let's talk through treatment and what if you are having acne. I mean, it's terrible. I mean, I can speak from experience how it can really take a knock on your confidence. And the worst part is, right, you don't want to be there slathering on makeup on top of your acne because that's only going to exacerbate the situation, right? Because it's going to further clog your pores.
Yeah.
And what can you do about acne?
Okay. So before we even go to the medical grade treatments, just some basic skincare advice if you have acne. Number one, don't pick. I mean, it's obvious, although we never follow.
You say that, and I'm like the most guilty culprit ever. Don't pick. It's terrible.
Don't pick at the lesions. Avoid aggressive exfoliation and scrubbing like on a daily basis. That's not great for acne because it can aggravate the skin and like worsen inflammation if it's already all inflammatory. Okay. And then with regard to a foundation, choose rather an oil-free liquid silicone matte foundation. Okay, because silicone-based products are less likely to enhance the follicular occlusions, the clogging of the pores. So that's just like a nice tip if you are going to wear makeup. Like there are more acne friendly products that one can select.
And sunscreen, actually,
Yeah.
because just
Yes.
to like just jump on something that you said, one thing that I found really helpful for my skin is swapping out my sunscreens because I was using like I always put SPF 50 on my face religiously, which I know is very
Yes.
important. But for
Yeah.
those of you who don't do it, please always wear sunscreen. But certain sunscreens have a more of an oil consistency, and I was finding that that was starting to clog my pores, whereas swapping out sunscreens honestly made a huge, huge,
Game
huge difference.
changer.
And I think, yeah, I think it is really like what you're saying, like just
Mm.
checking because your skin is producing these excess oil that's clogging your pores, then putting on top more oil is
Mm.
definitely something to watch out at.
Yeah. So okay, so those are the basic lifestyle advice. Then the treatment would depend on what type of acne you have. Mild, moderate, severe. So let's just talk through the treatment management because it's you basically upscale as you go along. So all patients should be on an oral contraceptive pill for reasons that we spoke to earlier. That is definitely has anti-androgenic properties that can combat the androgens that is driving this acne process on the skin. So definitely an oral contraceptive pill, right? You take a contraceptive history with the patient because maybe she's on certain medications that must be changed. So for example, if she's on a progestin only contraceptive, that should be addressed because that could be worsening the clinical picture. And I would advise we switch her to an oral contraceptive that's both combined with both estrogen and progesterone.
And I know you're going to kill me for interrupting you the whole time and running your
Yeah,
train of
it's
thought,
fine.
but you're saying like the first point of call is to put a woman on contraceptives, but that's quite like a controversial approach,
Mm,
right? So like what happens if you don't want to be on a contraceptive,
mm,
or actually your hormonal acne is caused from coming off a contraceptive, or you're
yeah,
looking to conceive or something. I mean, maybe you'll go on to that
100%.
in your like next steps, but
Yeah.
I guess.
No, no, 100%. I know it completely depends on the patient. It would be my first line recommendation, but we'd obviously have to assess the patient's needs or the stage she's at in life. And no, not everyone is keen to take an oral contraceptive pill. That's perfectly fine. And then we just jump to the next part of the treatment management. So we talk about the benzoyl peroxide, the gels. They come in different percentage preparations, but very good for with regard to antimicrobial activity. So really great as a baseline. You can use it as a wash. You could apply it as a gel in the mornings. If you have back acne, it's also great to just like wash all over the back. Shout out to my cousin, won't say names, but she messages me all the time with regard to advice. So cousin, hope you're listening. So that's the first one. And then I would introduce a tretinoin. So basically, topical retinoids are vitamin A derivatives, and you have a spectrum of them ranging from weak to very strong. Okay, so the weak ones are the retinols. These are over the counter medications. Sorry, they're not even medications per se. Anyone can buy them. They come in different percentages as well. And they on the skin get converted to the active forms. So they're considered weaker in a sense. And so you have the weaker over the counter retinols ranging to tretinoin, which is slightly more potent. And then later on, we'll get to the oral isotretinoin for the more severe cases.
And one thing
Mm.
also really important to mention with retinols, certain retinols can be too strong and can actually like break down your skin barrier.
Absolutely. So I'll quickly tell you my retinol story. So I actually went straight for the medical grade 0.05% tretinoin. And I'm quite lucky in that I've never suffered from severe acne. I actually used it for the anti-aging benefits. So it's very great for anti-aging. When I initially started using it, I was instructed by the doctor who prescribed it to me because it is a prescription medication, to take a pea-size amount and you mix it with a very good moisturizer. So I use the SBR, and then you apply it to the skin. And let me tell you, that doctor did not warn me enough that basically my skin broke out the next day. I looked like I had the worst sunburn. I was crying. I was like, oh my God, what have I done? It felt terrible. And I said to myself, no, never again. I literally wanted to chuck the tube away. And then I did some research, and it turns out that it is known as the retinol purge, very common. And basically, I went from 0 to 100, and it's probably more advisable to, you know, start with the retinols, the weaker ones, build your way up. I just went straight to the medical grade product. But you know what? I slowly have since reintroduced it. I then did it maybe once a week, then the following weeks twice a week, and I'm now no longer sensitive to it, and I actually use it like every second or third night just for the anti-aging benefits. But yes, it is important to mention that it can be very harsh on the face, and this is why this is a prescribed medication. So
And
yes.
how often should you be using them? How often should you use retinol? How often should you use, like, if you are on this like stronger medication, like how often should you be looking to use these?
So when you are prescribed the medication by a dermatologist or a general practitioner, you start with the cleanser, which is you try look for like an acne friendly cleanser, and clean your face, but don't not too harshly. And then you apply the benzoyl peroxide in the morning, and then moisturize throughout the day, and SPF. At night, you would then use your retinol. So retinol never, or retinoid, or whatever retinoid product you're using, never use that in the morning. Only at night, because it makes your skin very sensitive to burning. And then you can apply moisturizer over it. And I would say do it if you can tolerate that daily, then do it daily. Yeah, that would be the treatment plan. But I mean, of course, in the initial stages, you build your way up to that. In addition to that, one could consider topical clindamycin, which is an antibiotic, or oral antibiotics, a course of doxycycline for 3 months, just to get rid of that bacterium that's colonizing the face. So sometimes that's considered. And there's also azelaic acid, which if a patient cannot tolerate the retinoid, one could consider azelaic acid, which has also been shown to be quite beneficial. And then in the more severe cases with nodular cystic acne, one could consider isotretinoin, which is the oral form. And in order to receive this, you have to be on an oral contraceptive. It has to be done, and that's because it's highly teratogenic. In other words, if you are pregnant and you're taking oral isotretinoin, your baby may have congenital anomalies. So you have to be on it for that reason alone.
Okay.
And it also has very serious side effects. So I mean, it can cause very like intense drying of the skin, the eyes. It's thought to be associated with some mental health dips, but there's actually no conclusive evidence suggesting that. But it's thought to do so. So patients have to be screened, followed up regularly, blood tests done prior to initiation so that you can monitor the liver enzymes. So something to be taken quite seriously.
So what I'm hearing is diet, obviously, something that's really important to consider. Then you've got the benzoyl peroxides, saying that
Yes.
correct? Yeah, so like the
Yes.
gels and everything. Then the retinoids. Then
Mm-hmm.
also potentially some antibiotics, of course, of antibiotics that you may go on to.
Mm-hmm.
And then the tablet form of the retinoids, or the
Yes.
tryptoretinoid, or can't pronounce that.
Isotretinoin.
Isotretinoin that you'd be taking,
Isotretinoin.
isotretinoin that you'd be taking
Yes.
with a contraceptive. What about other things like, and I'm probably gonna butcher the
Mm.
pronunciation, but like niacinamide and or tea tree oil
Yes. Oh,
and all of these things.
can be used in conjunction. Tea tree oil, I'm glad you mentioned that. It's a product derived from an Australian tree, and it is known to possess a very good antimicrobial as well as anti-inflammatory properties. Studies showed a significant reduction in both inflammatory as well as non-inflammatory acne lesions. However, it had a slower onset of action when compared with conventional medical therapy. So it probably would work. And if you're very opposed to medical grade products, you could give it a try. Niacinamide as well. Niacinamide is a medical product, and it's also been shown to have some benefit. And often you'd find them in the cleansers. I think it's not like indicated as first line treatment because it's like a nice add on, but you're not gonna see
Uh,
instant benefits. Yeah.
Are there any other like facials or treatments or something? I feel like there's so much out there, right? So there's like hydro facials now, there's the laser facials, chemical peels. What would you recommend if you are more prone to acne, or you have like a breakout or something? What facial should you be looking
Yes.
at?
So again, I would say if in doubt, always consult a dermatologist first, because you could be doing more damage than good. But generally speaking, chemical peels are indicated in the management of acne as an adjunct for patients who desire an accelerated treatment response. And the type of facial or chemical peel that is advocated for is the superficial chemical peel that is comprised of salicylic acid as the chemical base. But this should not be done with patients who are already taking oral isotretinoin. Okay, they must complete their
Okay.
course and then it can be used in the maintenance stage. And yeah, it's very beneficial because it's both antibacterial and it decongests the face. So there aren't specific guidelines with regard to how often, how frequent. I actually can't speak to that, but not a bad adjunct. Then another mechanism is the microdermabrasion, like microneedling essentially. It's a non-invasive procedure in which abrasive crystals are propelled onto the skin, and this is all controlled via a vacuum suction system. This is just from my research. I'm not an expert in this, but basically it leads to exfoliation of the stratum corneum, so the outer layer of the skin. However, until further evidence is available, it is not suggested. So please do not do the microdermabrasion for the treatment of acne specifically. It can only be considered or should only be considered as a pre-treatment prior to photodynamic therapy, so like lasers and all of that.
And what would you kind of say, like, okay, like if you're in between, rather like save up your money and go for laser, or would you say like rather go for peels? I know there's also at-home peels. So there's a company called The Ordinary, and that has like this red peel that you leave on your face for 10 minutes. It's considered like one of the stronger over-the-counter, just, cosmetic products. But what would you recommend in terms of bang for your buck?
Yeah, I would recommend sticking to the medical grade products first. Get the medical products first, get that regime right, and use all of those as supplementary things. And I think when it comes to peels, I think it would be best to do it, with a professional who knows what he or she is doing with the skin, as opposed to doing it yourself, because it can go horribly wrong. But I would say stick to the basics. First, get the lifestyle factors right. Avoid the triggers. We spoke already to the triggers of acne. Just to touch on briefly the triggers for rosacea, the sun, so sunscreen, spicy foods, hot water. So always just pat your face with lukewarm water, nothing too hot. Excessive exercise and sweating. Some essential oils can really trigger or worsen the inflammation. So just know your triggers. That's my step one. Get a good routine going, and then you should be fine. Everything else, supplementary.
So I think we've covered so much. I still have so many other things to talk about, like double cleansing, so many different questions to ask. And I think that's probably something that we can cover in another episode on skincare. I'd really love to dig into all of that, like an entire episode dedicated to skincare routines.
Emma in her element.
Oh my God, I love this stuff. Honestly,
I've never seen you so excited, honestly. It's like me and menopause. I love menopause. I love talking about it. You love talking about skincare. So we're like the perfect duo.
It's really, honestly, skincare is my passion. But yeah, thank you guys so much for listening. Please do subscribe. And also follow us at the Ovarian Club on Instagram. And if you have any questions or thoughts, or you're really interested in certain topics, please shoot us a message. We love to hear from you. We've been getting really inspiring messages, which really keeps up us morale and just brings us back to the reason why we started this podcast. So thank you so much. And don't forget to tune in for our next episode.
The Ovarian Club, powering life, nurturing health, shaping sustainable wellness. See you soon, Follicle friends.